Hello students, myself Dr. Shreyas Joshi, and today I would be discussing some important concepts of pathogenesis in Ayurveda, that is Rog Nidan evam Vikruti Vignan in simple language. Let us see what are the specific learning objectives of the session. At the end of the session, first year homeopathy students should be able to understand stages of disease analysis, importance of Nidan Panchak, stages of disease progression, importance of stages of disease progression, assessment of the deceased or assessment of patient, Trividha Rugna Pariksha, Ashtavidha Rugna Pariksha, and concept of Ama. Let's start with the introduction. Ayurveda has 8 main branches as Kaya Chikitsa, that is general medicine, Balarog, that is pediatrics, Manas Chikitsa means psychiatry or psychology, Shalakya Tantra as ear, nose and throat, Shalya Tantra means general surgery, Damshtra Chikitsa toxicology treatment modalities, Rasayan Chikitsa rejuvenation therapies, and Vajikaran Chikitsa aphrodisiac respectively. Ayurveda concept of pathogenesis is called as Rog Nidan evam Vikruti Vignan. Though it is not included in Ashtanga Ayurveda, but it is an integral part in terms of diagnosis of disease. Ashtanga Ayurveda is incomplete without the Nidan or diagnosis of disease. Ayurveda is mainly based on Hetu, Linga and Aushad, collectively called as Triskandha Ayurveda. Hence, Ashtanga Ayurveda goes hand in hand with Triskandha Ayurveda. Rog Nidan mainly discusses Hetu and Linga aspect. The main aim is to pinpoint the disease exactly and to search for the specific pathogenesis behind it for better treatment planning. As we all know the famous quote, prevention is better than cure. This means it is always better to be in preventive aspect than to search for any cure. Ayurvedic style of diagnosis is exactly the same. It provides the steps or stages where the spread of the disease can be restricted to avoid further complications. Madhav Nidan is one of the Lagutrai Samhitas written by Madhavkar. It provides the detailed description of various diseases including their signs and symptoms. It also conveys essential knowledge regarding the types of diseases and their prognosis. This book is a valuable resource for understanding causes and disease pathogenesis relationship in Ayurvedic perspective. The main treatise of Ayurveda as Charak Samhita, Sushrut Samhita and Ashtanga Hrudaya also contributes a dedicated section as Nidana Sthan for disease causing factors and its pathogenesis. Rog Nidan word itself is self-explanatory as a diagnosis of a disease. It emphasizes diagnosing the disease before instilling any type of treatment. Examination of patient is of utmost importance to arrive at a concrete diagnosis. Ayurveda not only describes how to examine a patient but also guides how to assess a disease in terms of Roga Pariksha and Rogi Pariksha. Let's start with the Roga Pariksha or the analysis or assessment of the disease. In Ayurveda, for analysis of any disease, a special concept is described in the name of Nidana Panchaka. Nidana Panchaka is a crucial diagnostic tool in the modern era. The concept of Nidana Panchaka has gained the utmost importance as an increasing number of individuals are turning towards a holistic health approach. Roga Pariksha or analysis of disease gives us complete knowledge about the disease starting from the etiological factors to the actual manifestation of the disease. It is a comprehensive method of diagnosis that considers not only the physical symptoms but also includes psychological, social, and environmental factors that contribute to the disease formation. This approach allows for the identification and treatment of diseases by considering various factors that contribute to an individual's overall well-being. Nidana Panchak comprises of Nidana, Purvarupa, Rupa, Upashaya and Samprapti. Let's understand them one by one. The first one is Nidana. Nidana means the causative factors of the disease. In Ayurveda, Vyadhi Hetu refers to the causative factors or etiological factors that contribute to the onset and development of disease. Here are some common disease causing factors mentioned in Ayurveda. Aharaja Hetu. It means causative factors related to diet. It refers to improper dietary habits and consumption of incompatible foods, consuming excessive amounts of heavy, oily or unwholesome food, eating irregularly or combining incompatible food items can lead to digestive disturbances and subsequent diseases. Viharaja Hetu. This factor relates to improper lifestyle practices and activities such as a sedentary lifestyle, lack of exercise, irregular sleeping patterns, excessive physical or mental stress, and unhealthy daily routine. This disrupts the body's natural biological clock and contributes to development of diseases. Manasik Hetu. This factor involves psychological and emotional aspects that can impact in individuals' health. Mental stress, negative emotions like anger, fear, grief, and prolonged psychological disturbances lead to disturb the Tridosha balance, that is, Vata, Pitta, Kapha balance, and contribute to the manifestation of diseases. Understanding the disease causing factors is essential as it helps in identify the root causes of diseases and enables the implementation of holistic treatment approach. Avoiding such causes restricts the further spread of disease immediately. Purvarupa. Purvarupa means the prodromal features. The symptoms produced before the actual manifestation of the disease are called as Purvarupa. The term Purvarupa is derived from two Sanskrit words. Purva means before and Rupa means signs or symptoms. It signifies the initial signs and symptoms that occur before the complete manifestation of a disease. These symptoms act as warning signs or early indicators of an impending illness. Recognizing and understanding Purvarupa is important in Ayurveda as it helps in early detection, prevention, and timely management of disease. For example, irritation of the eyes, itching in the throat and ear, malaise, and excessive yawning are some of the warning signs before the actual expression of fever. Next one is Rupa. In Ayurveda, Rupa refers to the signs and symptoms that manifest during the course of a disease. It involves the observable and experiential features that aid in identifying and understanding the specific nature and characteristics of an illness. Vyadhi Rupa plays a crucial role in diagnosis, prognosis, and treatment planning in Ayurveda medicine. Ayurveda describes two types of Rupa or Lakshana as Rugna Samvedya Lakshana and Vaidya Samvedya Lakshana. Rugna Samvedya Lakshana means symptoms which experienced by the patient, and Vaidya Samvedya Lakshana means signs observed by the doctor or physician. Text describe numerous signs and symptoms of different diseases, but here are some general examples. Examples of physical symptom includes fever or elevated body temperature, respiratory symptoms like cough, congestion, and breathlessness, digestive disturbances such as nausea, vomiting, or diarrhea. Examples of mental and emotional symptoms can be anxiety, stress or restlessness, mood swings or emotional instability, sleep disturbances or insomnia. Examples of functional symptoms include altered bowel movements such as constipation or diarrhea, urinary abnormalities like increased frequency or difficulty in passing urine. It is important to note that Ayurveda recognizes the uniqueness of each individual and emphasizes the concept of individualized medicine. Therefore, the sign symptoms observed in a person may vary based on their constitution and other factors. This information helps in formulating a customized treatment plan and promoting overall health and vitality. Upashaya, the practice of using medicine, diet, and regimen that result in a improvement in one's mood and sense of well-being is referred to as Upashaya. It offers comfort to individuals by utilizing various forms of treatment, nutrition, and routine. For example, oil application and hot fermentation in osteoarthritis and rheumatoid arthritis patients. If the patient is suffering from osteoarthritis, then oil application and hot fermentation will be beneficial and he will feel better in terms of signs and symptoms. But if he is suffering from rheumatoid arthritis, then oil application and hot fermentation will aggravate the symptoms. The next one is Samprapti, the process of expression of disease by the etiological factors and other contributory factors all over the body is called as Samprapti or pathogenesis. It is also known as Jati or Agati. This provides the proper knowledge about the pathway of disease manifestation. This provides complete knowledge of the disease development stages, starting from the cause to the final stage of an expression. The knowledge of Samprapti is essential because it gives a precise and comprehensive picture of the nature of the illness. Samprapti help us to understand the prognosis of the disease. It is always beneficial to know the factors which are responsible for the genesis of a disease rather than knowing just the disease. Let's understand the importance of Nidana Panchak. The concept of Nidana Panchak indicates about manifestation and prognosis of disease. Knowledge of Nidana Panchak helps in disease identification. Nidana provides an understanding of the disease and recommendations for avoiding the contributing factors. Nidana, Purvarupa, Rupa, Upashaya, and Samprapti aid in the effective planning of treatment. Knowledge of underlying causes or Nidana of a disease is essential for a physician in determining the potential outcome or prognosis. The concept of Nidana Panchak can help determine the chronicity of the disease. Early diagnosis is crucial in preventing the development of further complications associated with a disease. Kshatriyakal or stages of disease progression. To pacify the disease, physicians have to strike at the right time and at the right place to minimize the possible further damage. The Kriyakal provides 6 stages where, according to the condition of the disease, the physician can decide the right time for treatment installation. Kshatriyakal comprises of Sanchaya, that is stage of accumulation, Prakopa means stage of aggravation, Prasara means the stage of spreading, Sthana Samshraya, that is the stage of localization, Vyakti means the stage of expression, and Bheda, that is the stage of differentiation. Kshatriyakala is a speciality of Acharya Sushruta as he has elaborated the disease progression in a precise manner. These stages guide physician to know about the status of disease progression. Ayurveda describes Tridosha Siddhanta as Vata, Pitta and Kapha. When these 3 are in their normal balanced phase, the person is termed as Swastha or healthy. If the balance between these 3 gets disturbed, then the person is called rogi or diseased. Causative factors imbalances the tridosha in the body and the disease is manifested. As you can see in the pictures, the tap is filling the tub. The tub is still filling and has not overflown. This stage is called as sanchaya. When the tub gets overfilled, the water starts to spill out of the tub or bucket. This stage is called as prakopa. As all of you would be knowing that the water tends to flow downhill. So, spilled water will spread and flow downhill. This stage is called as prasara. Flowing water through downhill gets collected at a lowland. This is called as sthana samshraya. Because of the water collected in lowland, algae starts growing, causing harm to the natives of the lowland. This stage is called vyakti. And lastly, algae occupy the lowland and various other species can be seen in the collected water at the lowland. This stage is called as bheda. Let's understand this concept with the tridosha aspect. Sanchaya, that is stage of accumulation. Sanchaya means to accumulate. If a person is serving an improper dietary regimen or faulty lifestyle, then the causative factor will start the vitiation of the doshas or imbalance of tridosha. In this stage, tridosha gets confined and starts accumulating in their respective places. Prakopa, that is stage of aggravation. Prakopa means to aggravate. If the person keeps on doing the wrong things or the causative factors keep contributing, then tridosha will start to leave their respective places. This stage is called as prakopa. The next stage is prasara, that is stage of spreading. Prasara means to spread. In this stage, the aggravated tridosha begins to spread from its primary locations to other parts of the body, affecting different tissues and organs. This stage is characterized by the manifestation of early symptoms. Sthana samshraya means the stage of localization. Sthana samshraya means to localize. The aggravated tridosha settle and embed themselves in specific tissues or organs, leading to manifestation of specific signs and symptoms associated with the affected area. This stage determines the site of the disease and starting point for the purvarupa. Vyakti, that is the stage of manifestation. In this stage, the disease becomes evident with clear signs and symptoms which are characteristics of a particular condition. The person experiences the full expression of disease. Bheda, or the stage of differentiation. The final stage involves the differentiation of the disease and its subtypes, severity and complications. This stage helps in determining the specific treatment approach. Let's better understand with an example. A person keeps doing the wrong things which are harmful to his body, like he keeps eating the junk food at all the time, do some addiction to the alcohol in excessive. There is sanchay or accumulation of the causative factors in his body. Then he becomes lazy, lethargic and gains a considerable amount of weight. His friends advise him to stop all the wrongdoings, but still he continues to do the same. This amounts to an increase in the causative factors accumulation and they starts to overflow. His abnormal weight gain reveals the cholesterol levels are above the borderline, depicting the stage of prakopa. The doctor advises him some exercises and some lifestyle modifications to overcome the situation. But he denies and continues his earlier routine. This amounts to the prasara. Cholesterol levels get deranged. Due to deranged cholesterol levels, plaque starts depositing in the coronary vessels amounting to sthana samshraya. Due to this, he experiences intermittent chest pain, breathlessness on walking, a changed rhythm of pulse as the early sign symptoms or Purvarupa of heart disease. On one fine day, a plaque blocks the coronary vessel and there is an expression of the disease or Vyakti called heart attack. Depending on which vessel is blocked, Bheda or differentiation can be done. In this way, Kshatriyakal becomes a physician's aid in understanding the pathogenesis of a particular disease. Importance of Kshatriyakal. Predisposition. Early diagnosis of disease or prediction of futuristic disease can be done with the help of Kshatriyakal. Understanding of Kshatriyakal helps physician to reach the perfect diagnosis of a disease. Effective planning and execution of treatment becomes easy with the understanding of the stages of disease progression. The prognosis of disease can be done with an understanding of these stages. Monitoring of Tridosha as well as monitoring and evaluation of ongoing treatment can be done. The outcome of disease in terms of further complications, if any, can be evaluated and the spread can be restricted with a better understanding of these stages. Earlier, we have completed the Roga Pariksha. Let's head towards the Rogi Pariksha. In modern medicine, 4 tools of patient examination can be seen as IPPA. I stand for inspection, P denotes palpation, another P stands for percussion, and lastly A denotes auscultation. In Ayurveda, patient examination involves a comprehensive assessment of the individual's physical, mental, and emotional characteristics to determine their unique constitution and overall health status. Ayurveda practitioners employ various methods of examination to gather information to reach a diagnosis. Here are 3 commonly used tools of patient examination in Ayurveda is termed as Trividha Rugna Pariksha, namely Darshan, Sparshan and Prashnan. Darshan means to observe, Sparshan means to palpate, and Prashnan means to obtain the history of illness by questioning. Let's understand the Trividha Rugna Pariksha, starting with the Darshana, that is observation. Darshana means observation. Observation involves visually assessing the patient's physical appearance, body structure, and gait. Ayurveda practitioners carefully observe the following aspects: the inherent physical and mental characteristics of the individual are observed, including body shape, size, complexion, hair type, and eye color. This helps determine the person's constitution. The face is examined for signs such as wrinkles, blemishes, color variations, facial expressions, which can indicate imbalance and specific health conditions. Body posture and movement. The individual's posture, gait, movement patterns, and agility are assessed to gain insights into their overall physical conditions. For example, yellowish discoloration of sclera or white portion of the eye in jaundice patients, redness, watering of eyes, and matting of eyelashes suggest possible conjunctivitis. Next is sparshan. Sparshan means to palpate. Palpation involves examination of the body through touch, that is tactile examination. By palpating different parts of the body, Ayurveda practitioner gather information about the following: skin texture, temperature, moisture and sensitivity are assessed to determine its condition and detect any abnormalities. Pulse examination. Ayurvedic pulse diagnosis, that is Nadi Pariksha, involves palpating the radial artery and assessing its characteristics including strength, rhythm and quality. Areas of tenderness, swelling, enlargement or pain are palpated to identify specific health issues. For example, increased temperature in fever, hypertrophied or enlarged tonsils palpable in external throat examination, enlargement of liver and spleen can be palpated in the abdominal examination. Prashnan. Prashnan means history taking by questioning. It is an essential part of patient examination. It involves direct communication with the patient to gather information about their chief complaints, past illness, operative history, obstetric history, especially in the female patients, family history, social history, lifestyle, habits, diet, emotional well being, and any other relevant factors. Through detailed questioning, Ayurveda practitioners gain insight into the individual's unique experiences, concerns, and challenges. This information helps in understanding the causative factors and formulating an appropriate treatment plan. Brief history taking should be comprised of the 5 W's in medical practice as who, what, where, when, and why. By combining observation, palpation, and questioning, the Ayurveda practitioner gathers comprehensive information about the patient's constitution, current health status, and potential root causes of the condition. This holistic approach to patient examination forms the basis for personalized treatment strategies aimed at restoring balance, promoting health, and preventing disease. Another tool to examine a patient is Ashtavidha Rugna Pariksha. An Ayurvedic classical text called Yoga Ratnakar describes Ashtavidha Rugna Pariksha in detail as Nadi, Mala, Mutra, Jivva, Shabda, Sparsha, Druk, and Akruti. Ashtavidha Pariksha is also called as Ashtasthana Pariksha or examination of 8 sites. Let's start with the first site, Nadi Pariksha, that is pulse examination. Pulse examination involves palpating the radial artery to assess its characteristics such as rhythm, strength, speed, and quality. The Ayurveda text called Sharangdhar Samhita mentions about the detailed description of Nadi Pariksha and its implementation. Next site is Mala Pariksha, that is stool examination. Stool examination involves examining the color, consistency, frequency, and other aspect of feces. For example, whitish colored stool is observed in obstructive jaundice patients. Watery consistency of stools can be seen in gastroenteritis. If a patient is suffering from chronic constipation, then fecalith formation occurs. Fecalith means stool gets hard just like the stone, and it is very foul smelling, and the patient experiences tremendous pain while passing the stools. Mutra Pariksha or urine examination. Urine examination involves observing the color, consistency, odor, and the other characteristics of urine. A unique method of Mutra Parikshan is described in Ayurveda as Taila Bindu Parikshan. A drop of oil is placed on the patient's collected urine and behavior of that Taila Bindu is observed. Ayurveda classical text Yoga Ratnakar has references regarding the different behavioral patterns and their interpretation in specific conditions. Jivva Pariksha or tongue examination. Tongue examination involves observing the color, coating, texture, and other characteristics of the tongue. For example, white coated furred tongue suggestive of indigestion. A special condition called geographic tongue means neatly marketed red and white patches on tongue resembling a map-like structure. Shabda Pariksha or speech examination. Speech examination involves observing the quality, tone, rhythm, and clarity of an individual's speech. It helps in assessing the functioning of respiratory system and vocal cords. This can be correlated with percussion examination. Shabda Parikshan is not only limited to speech but also extends up to the types of resonances that are sounded by the organs. For example, heart sounds, lung sounds. Lung lobes emit resonating sound, a low-pitched sound on percussion. Tympani is a high-pitched sound and can be heard in ascites patients. A dull sound can be heard in the areas of dense tissues like the liver. Sparsha Pariksha. Touch examination involves palpating different parts of the body to assess tenderness, sensitivity, temperature variations, and other tactile sensations. It helps in detecting muscle tone, enlargement, structural abnormalities, etc. Druk Pariksha, that is visual examination. The visual examination involves careful observation of physical features, facial expressions, body postures, and overall appearances. It aids in identifying specific health conditions and overall vitality. Last one is Akriti Pariksha, that is examination of general appearance. Examination of general appearance involves assessing the overall appearance, body shape, size, complexion, hairs, nails, gait, and other physical attributes. It helps determine the individual's prakriti, that is constitution, and potential health status. As shown in the picture, a lady is holding an ice pack on the left cheek, suggests a toothache. Such a stance of the patient can give idea of possible diseases. These 8 methods of patient examination provides valuable information about the individual's constitution-specific health conditions and overall well-being. Ayurveda practitioners use these examination tools in conjunction with questioning, detailed medical history, and clinical observation to formulate personalized treatment plan and promote optimal health. Concept of ama or meaning of word ama is unripe. It is an undigested and unprocessed substance that accumulates in the body as a result of impaired digestion and metabolism. Ama is considered as a major causative factor for various diseases and is believed to disrupt the body's natural balance and vitality. Ama is characterized by its heavy, sticky, and slimy nature. Ama can accumulate in various parts of the body and interfere with the normal functioning of organ and system. It can hinder the flow of nutrients, energy, and information throughout the body, leading to the onset and progression of diseases. Let's understand it with some key aspects of role of ama in disease pathogenesis. Ama can accumulate in various parts of the body and interfere with normal functioning of organs and system. It can hinder the flow of nutrients, energy, and information throughout the body, leading to the onset of and progression of diseases. Now we have seen the characteristics of ama in the previous slide. Let's head towards the causative factors for the production of ama in the body. Poor dietary choices. Consumption of heavy, fried, processed, or incompatible foods, overeating, day sleeping, sedentary lifestyle, mental stress, or irregular eating habits can compromise digestion and contributes to ama formation. This disrupts the enzyme cycle, that is Jatharagni, as well as the digestive juices, resulting in a disturbance in the normal digestion process, leading to the production of ama. Suppression of natural urges, that is ignoring or suppressing natural urges such as urination, defecation, can disturb the digestive process and result in ama accumulation. A compromised immune system fails to identify and eliminate ama, allowing it to build up in the body. The causative factors lead to the production of ama in the body, and the body gives signals in terms of sign symptoms as follows: fatigue and lack of energy, mental fog or dullness, poor appetite and indigestion, coated tongue and bad breath, a feeling of heaviness or lethargy, body odor or unpleasant body secretions, skin problems including acne or rashes, joint pain or joint stiffness. The root cause of ama production is disturbed enzymatic and digestive process. So, the treatment should focus on restoring the enzymes and digestion to the normal extent and getting rid of the produced ama. that is undigested material from the body. This can be achieved with the help of Dipana, Pachana and Dipana Pachana procedures. This means strengthening the digestive fire, giving support to the digestive process. A mere consumption of hot water can help in the digestion of ama. Various Panchakarma procedures like Vaman means emesis and Virechan means purgation helps to throw out the ama produced in the body. Lifestyle modifications like regular exercise, maintaining a healthy daily routine, managing stress, and ensuring proper sleep are essential for promoting healthy digestion and minimizing ama formation. To summarize the session, let's revise the points we discussed. Rogamadav Parikshet Tadnantaram Aushadham. One should not hurry in prescribing treatment before the diagnosing a disease. Main Ayurved treatises, that is Bruhatrayi such as Charak Samhita, Sushrut Samhita and Ashtangrudaya, dedicated one section as Nidana Sthan. Madhav Nidan book written by Madhav Kar compiled the references and made some additions, giving the comprehensive text containing causative factors, signs and symptoms, including cardinal signs of respective diseases. Assessment of disease carried out by the Nidana, Purvarupa, Rupa, Upashaya and Samprapti, collectively called as Nidana Panchak. Understanding Nidana Panchak helps to avoid the causative factors, effective planning of treatment, determination of chronicity and avoid further complications. Stages of disease progression, which means Shatkriya Kal, that is Sanchaya, that is stage of accumulation, Prakopa means stage of aggravation, Prasara means the stage of spreading, Sthana Samshara means the stage of localization, Vyakti, that is stage of expression, and Bheda means stage of differentiation. These 6 Kriya Kala gives us the idea of disease pathogenesis. Shat Kriya Kala becomes a physician's aid in understanding the pathogenesis of a particular disease. Shat Kriya Kala enables physician to diagnose a disease, monitoring a treatment plan, disease outcome and prognosis of diseases. Previously, we discussed the Roga Pariksha or assessment or analysis of disease. The next part we discussed is Rogi Pariksha or tools for patient examination. It is carried out in 2 methods such as Trividha Rugna Pariksha and Ashtavidha Rugna Pariksha. Trividha Rugna Pariksha includes Darshan, Sparshan and Prashnan. And Ashtavidha Rugna Pariksha involves Nadi, Mala, Mutra, Jivva, Sparsha, Shabda, Drik and Akruti. While examining the sites, physician gets the idea of an impending illness and pathogenesis behind it. In modern medicine, IPPA is followed, that is inspection, palpation, percussion and auscultation. The 5W are of very much importance in medical practice in terms of detailed medical history, such as who, what, when, where and why help in procuring detailed medical history from the patient by questioning. Ayurveda explains as Rogaha Sarvepi Mandegno. Ayurveda explains the root cause of all diseases as impaired digestive fire or improper digestion. This indigestion will give birth to ama, which will lead to various diseases. Common causes of ama formation includes poor dietary choices, weakened immunity and lifestyle disorders. This contributes in the production of ama in the body. The produced ama is indicated by various sign symptoms as fatigue, lethargy, unpleasant body odor, skin problems, joint stiffness, etc. Ayurveda have described several ways to get rid of collected ama in the body as Dipan Pachan, some Panchakarma procedures and lifestyle modifications. These are some important concepts of pathogenesis in Ayurveda, that is Rog Nidan evam Vikruti Vidyan. Here are some references from the textbooks and some research papers to know more about the Rog Nidan evam Vikruti Vidyan.